Welcome to Chapter 15, the female reproductive system. So today we are going to go through all the parts of the female reproductive system, pronunciations, abbreviations, the parts of the female reproductive system, the hormones, the cycles, menopause, and then different types of contraception. So let's start with the external genitalia and the vagina. The perineum in the female is that region between the thighs with that pubic symphysis in the front and the coccyx in the posterior. The anus is in that perineum. The vulva is the term for the external genitals. The vulva consists of the mons pubis, the labia minora and majora, the clitoris, and vestibule. The vagina, or birth canal, connects the vulva to the uterus. It has three main functions: discharge of menstrual fluid, it receives the penis and semen, and delivery to deliver a baby. So let's look at these terms here. Minora is going to mean smaller. Majora means greater. Labium means lip. Hymen means membrane. And then that mons means mountain. So the vagina, again, is what connects the uterus to the vulva, that out in the external and that internal portion. The urethra is embedded in its anterior wall. That vagina, again, is for discharging of menstrual fluid, receives the penis and semen during intercourse, and it's used to deliver a baby. Fornix means vault. The fornix is an arch-shaped, blind-ended part of the vagina behind and around the cervix. Mons means mountain. Pubis means pubic bone. So the mons pubis is a very fleshy pad with pubic hair. It's overlying that pubic bone. It's a lot of fat sitting right in that area to help to kind of protect that pubic bone. The vagina means sheath. So the vagina is the female genital canal extending from the uterus to the vulva. And that vulva means a wrapper or covering. So that vulva is the female external genitalia. So we have the singular form. Let's look at the plural. Labrum becomes getting ahead of myself with letters. Labia, majus, majora, minus, minora, fornix becomes fornices. So we're going to change these terms into the adjective form and define them. Cervix, cervical, ovary, ovarian, vaginal, which the vagina is the female genital canal, and vulva becomes vulvar. The vulva is the term for the external female genitalia. So let's look at some different disorders of the vulva and the vagina. We have bacterial vaginosis, which is an inflammation of the vagina causing a fish-like odor. It is caused by bacteria and treated with antibiotics. Toxic shock syndrome is a life-threatening illness caused by toxins in the bloodstream. It arises from overgrowth of vaginal bacteria exacerbated by superabsorbent tampons. Vulvovaginal candidus is known as a yeast infection and is often a side effect of taking antibiotics. The main sign is like a cottage cheese-like discharge from the vagina. Vulvodynia is a chronic severe pain around the vaginal orifice, sometimes causing dyspareunia. And then there's vaginal cancer, which is uncommon and is treated with surgery and radiation therapy. Vaginosis means, osis means condition, so vaginosis is a disease of the vagina. Vaginitis and vulvovaginitis, the itis means inflammation. So vaginitis is the inflammation of the vagina. Vulvovaginitis is inflammation of the vulva and vagina. There we go, sorry. Osis, itis. Now we have ectomy, means surgical excision. So vestibulectomy is that surgical excision of the vulva. And then that all means pertaining to, so vulvovaginal means pertaining to vulva and vagina. Dyspareunia. Dys means painful. Perion means lying beside sexual intercourse condition. So dyspareunia is going to mean pain during sexual intercourse. Vulvo means vulva. Dysdynia. Dynia means pain. Vulvodynia is going to mean chronic vulvar pain. Both of these words mean pain. One is a prefix, one is a suffix. So the ovaries, uterine or fallopian tubes, and the uterus. So each ovary is an almond-shaped organ about 1 inch long and a ½ inch in diameter. The ovary's main function is to produce and release eggs, or also known as ovum, and secrete hormones that affect puberty, menstruation, and pregnancy, estrogens and progesterones mainly. Each uterine tube is a canal about 4 inches long, extending from the uterus and opening to the abdominal cavity near the ovary. The tube's main function are to enable sperm and egg to meet and fertilize. Then the uterus is that thick-walled muscular organ in that pelvic cavity. LPN is licensed practical nurse. Certified health education specialist. GYN is for gynecology, and then OB is that obstetrics. So some words come from that Latin and Greek origin again. Fimbria means fringe. The fimbria is a finger-like structure at the end of that uterine tube. Os means mouth. The os is the opening into the canal. It's that cervix, that opening into that uterus. Ovum means egg. So the ovum is the female reproductive egg, while uterus means womb. The uterus is an organ in which an egg develops into a fetus. Ovarian hormones. Estrogens. Estrogens are produced in the ovarian follicles, and their sexual functions are to convert girls into sexually mature women through theliarch, pubarch, and menarche. Regulate the menstrual cycle and be involved in pregnancy when it occurs. Progesterone is produced by the ovaries corpus luteum and also the adrenal glands. Its sexual functions are to prepare the lining, that endometrium, the inside lining of that uterus, for implantation of the egg, inhibit lactation during pregnancy, and produce menstrual bleeding if pregnancy does not occur. Oogenesis is the formation of eggs that occurs in the ovaries. Ova are formed from oocytes. And then ovulation is that release of that mature ova, that mature egg, from the ovaries. Normally one fully developed ovum every 28 days, estimating every cycle is different, from alternating ovaries. So menses and menstruation are nouns that refer to the monthly uterine bleeding. Menstruate is the verb and menstrual is the adjective. Ovary is the female gonad or sex organ that produces an ovum. Ovarian is the adjective form to refer to anything related to the ovary, and ovulation is the process of releasing that egg cell. Pregnancy is the noun used to refer to the 40 weeks of gestation, while pregnant is the adjective used to refer to pregnancy. So menarche is the onset of menses. It's that first menstrual period. That root, men, means mouth, and that suffix, arch, means beginning. Pubarch is that development of pubic hair. Pube means pubis. That arch means that beginning, that pubic hair and that axillary hair. Theliarch is that development of the breasts. Thel means breast or nipple, then arch means beginning. So involutate, involute, there we go, means decrease in size. Ovulation is the release of an oocyte from a follicle. That follicle is a spherical mass of cells containing a cavity. And then antrum is a closed cavity. Lutein is a yellow pigment from that Latin word for saffron, yellow. Luteal means pertaining to the corpus luteum, yellow tissue. That corpus luteum is that yellow structure formed at the site of a ruptured ovarian follicle. Corpus means body. Corpus albicans is that atrophied corpus luteum from the Latin word white. So disorders. Polycystic ovarian syndrome, PCOS, is the formation of multiple follicular cysts, fluid-filled sacs, in both ovaries, leading to an absence of ovulation and ultimately the absence of menses. Ovarian cancer is the second most common gynecologic cancer after endometrial cancer. The peak incidence of ovarian cancer is in the 50 to 60 year age group. Ovarian cancer is treated with surgery and chemotherapy. Amenorrhea is that absence of the menses cycle. Primary amenorrhea is the failure to begin menstruating by the age of 16. Causes include drastic weight loss from malnutrition, dieting, bulimia, or anorexia nervosa, extreme exercise, extreme obesity, and chronic illness. Secondary amenorrhea is when a woman who has previously menstruated normally misses 3 or more menstrual cycles in a row, not in menopause and not pregnant. Secondary amenorrhea can be caused by ovarian disorders like polycystic ovarian syndrome, excessive weight loss, low body fat percentage, excessive exercise, and certain drugs like antidepressants. Dysmenorrhea is painful, difficult menstruation. Premenstrual syndrome is pain or discomfort associated with menstruation. Secondary dysmenorrhea is pain associated with disorders such as endometriosis or genital tract infections. So those NSAIDs is non-steroidal anti-inflammatory drugs. PCOS, polycystic ovarian syndrome. There we go. Then PMS, premenstrual syndrome. Okay. Ovulate is the verb. Ovulation is the noun. Menopause is the noun that refers to a permanent cessation of menses. You must go 12 months without menses to be considered in menopause. Menopausal is that adjective. Palpate is the verb that means to examine with the fingers and hands. Palpation is the noun. Luteum is that noun referring to that yellow tissue. Luteal is the adjective that means pertaining to yellow tissue. Endometriosis is when the endometrium becomes implanted outside of the uterus. So that tissue that makes up that endometrium is found other places in that pelvic cavity. It can lead to cysts and scar tissue formation. We don't know what causes it. Salpingitis is inflammation of the uterine tubes that can be caused by an ascending bacterial infection, often STIs or STDs. The scarring associated with this is common cause of infertility. Those uterine tubes get scarred and they can scar closed, so those ovums and those sperm can't come together. A uterine prolapse is when the uterus sags or slips from its normal position. Uterine fibroids are benign fibroids, little growths that grow in the myometrium, so the muscular layer of the uterus. Uterine fibroids are called fibromyomas, leiomyomas, or myomas. Treatment for uterine fibroids includes surgery and hormone therapy. Abnormal uterine bleeding may be caused by fibroids, endometrial polyps, and cancer. But some uterine bleeding has no known cause. Uterine bleeding is treated by treating the underlying cause, or if cause is unknown, by dilating and curate, or by endometrial ablation. So they kind of cause that endometrium to become completely scarred over so it cannot grow and shut off. Cholepexy. Polyp, O, is the combining form for vagina. Pexy is a suffix that means fixation. So, surgical fixation of the vagina. Endometriosis, endo is that prefix that means within or inside. Metry means uterus, and osis is that condition. Polymenorrhea, poly means many or excessive. Meno, menses. Rhea means to flow. So polymenorrhea is more than normal frequency of menses. So let's look at these words here. Hysterectomy, myomectomy, and salpingomectomy. Salpingectomy, there we go. They all have ectomy, which means surgical excision. Hyster means uterus, so hysterectomy means surgical removal of the uterus. Myome, my means muscle, ome means tumor. So myomectomy is surgical removal of a myoma. Salping means tube. Salpingectomy is surgical removal of that uterine tube. Burse is a root word that means turn. That ion, I-O-N, the suffix means process. So retroversion is that tipping backwards of the uterus, because retro means backwards. Anti means forward, so antiversion is that forward displacement or tilting of the uterus in this case. Seal means hernia. So cystocele, cysto means bladder. Cystocele is a hernia of the bladder into the vagina. Recto, combining form for rectum. Rectocele is a hernia of the rectum into the vagina. Endometrial cancer is the fourth most common cause or cancer within women. The most common sign of endometrial cancer is vaginal bleeding after menopause. So endometrial cancer is treated with a hysterectomy, radiation therapy, and chemotherapy. Cervical cancer is diagnosed with a pap smear. This is actually, this picture right here is what the cervix looks like when they go in to actually look. Treatment of the cervical cancer can include conization, loop electrosurgical excision procedure, laser surgery, and cryosurgery. That pap test relies on microscopic examination of those cervical cells. So an ablation is removal of tissues to destroy function. Curettage means scraping of the interior surface of a cavity. Dysfunctional means difficulty in performing. Dysplasia, abnormal tissue formation. DNC is dilation and curettage. PAP technically stands for Papaniculaou, the Greek American physician who first developed the PAP test. Menopause. Menopause is the cessation of menses for over a year. It's 12 months without a menses. In the absence of pregnancy in women who are normal, it's normally between the ages of 45 and 55. In menopause, estrogen and progesterone levels decrease significantly because those ovaries are now atrophying. They're not producing that hormone. The risks and benefits of estrogen replacement therapy are a very hotly debated deal here because there's a lot of side effects to hormone replacement therapy. It has a lot of benefits and it has a lot of problems. It can cause cancers. It can cause strokes. Infertility is the inability to become pregnant after 1 year of unprotected intercourse. Causes of infertility include infrequent ovulation, scarring of the uterine tubes, and structural abnormalities of the uterus. Diagnosis of infertility includes blood levels, a hysterosalpingogram, ultrasound of the uterus, and a laparoscopy. Treatment of infertility includes treating the underlying cause, intrauterine insemination, and in vitro fertilization. So intrauterine insemination is the insertion of sperm directly into the uterus via a special catheter. In vitro fertilization is when ovum and sperm are combined in a laboratory dish, and then 2 to 4 resulting embryos are placed inside the uterus. Complications of in vitro fertilization is multiple pregnancies. Contraception is the prevention of pregnancy. Behavioral methods include abstinence, which is the only 100% way to prevent pregnancy. Unfortunately, everything else has some sort of failure rate, including birth control. Coitus interruptus and a rhythm method. The latter two methods, there's more than a 20% fail rate. There's quite a few. It's a lot higher than that. There's barrier methods. Condoms are available for both males and females. They have a 5 to 10% failure rate. Diaphragms and cervical caps consist of latex or rubber domes that are inserted into the vagina and placed over the cervix. When used with a spermicide, they have a 5 to 10% failure rate. Spermicidal foams and gels are inserted into the vagina. Used on their own, they have a 25% failure rate. Intrauterine devices are inserted into the uterus and used for 1 to 4 years. Hormonal methods include birth control pills, patches, injections, implants, and pills taken to inhibit ovulation or induce menstrual flow. They have a failure rate of 5% for oral pills and a less than 1% for patches or injections. Why is there such a high failure rate for pills? Because people forget to take pills. People get preoccupied with something else and they forget. Then there's surgical methods like tubal ligation, cutting those uterine tubes. In females, and a vasectomy in males, and those still do not have a 100% success rate. I've known several people, males, that have had vasectomies and still had children post-vasectomy. Postcoital means after sexual intercourse. Progesterone is a synthetic form of progesterone. IUD is an intrauterine device. IFS is that in vitro fertilization. So contraception, this is a noun that's gonna refers to the prevention of pregnancy. Contraceptive is that adjective and a noun. Insemination is a noun that refers to the process of introducing semen into the vagina. Inseminate is the verb form of insemination. So let's look at different gynecological diagnostic and pharmacology. So a laparoscopy. This directly examines the uterus, uterine tubes, and ovaries through a laparoscope inserted into the abdominal cavity through a small incision in the abdominal wall. Cervical biopsy is a procedure to remove tissue from the cervix for pathological testing and for precancerous lesions or cervical cancer. Coloscopy uses an instrument with a magnifying lens and a light called a coloscope to examine the lining of the vagina and cervical canal. Hysterectomy is the examination of the inside of the uterus, or hysteroscopy, sorry. I think I said hysterectomy. That's the removal of the uterus. Hysteroscopy is that examination of the inside lining of that uterus by a flexible light tube called a hysteroscope. And then endometrial biopsy is a biopsy taking tissues from the lining of the inside of that uterus. Dilation and curettage, or also known as a D and C. This is a surgical procedure in which the cervix is dilated so that the cervical canal and uterine endometrium can be scraped to remove abnormal tissue for pathological examination. I've been told it's very painful. Loop electrosurgical excision procedure, also LEAP, uses a wire loop heated by electricity to remove tissue from the vagina and cervix for pathological examination. Ultrasound of the abdomen can show the shape and size of the uterus. That Pap test is screening for cervical cancer, while a pelvic ultrasound uses sound waves to scan and take pictures of pelvic organs. Here's the surgical procedures. That hysterectomy is the removal of the uterus. Oophorectomy is the removal of one or both ovaries. Myomectomy is the removal of fibroids, but you leave the uterus in place. Endometrial ablation removes a thin layer of the uterine endometrium. Usually you kind of singe it off, technically, using chemicals. Hormone therapy uses gonad releasing hormone that usually gets released from that hypothalamus, which causes estrogen and progesterone levels to fall so that menstruation stops and fibroids shrink. Laser surgery is a laser beam is used to kill precancerous and cancerous cells. Intrauterine insemination is where sperm are inserted into the uterus via a special catheter. So hormone replacement therapy, HRT, are medications to relieve menopausal symptoms by replacement of diminished circulating estrogens and progesterones. Oral contraceptives usually contain the synthetic form of those hormones, progesterone and estrogen, and they work by preventing ovulation from happening. So release of that oocyte from the ovary. STD treatments include metronidazole for trichomosis, astromycin for chlamydia, and cefazolin for gonorrhea. Okay, pregnancy. Next part. So contraception is going to occur when an egg is fertilized by a sperm cell. Fertilization typically takes place in the distal portion of that uterine tube. An ovulated egg can only survive for 12 to 24 hours, so it must be fertilized by a sperm in order to develop into an embryo. Implantation occurs in the uterus as the embryo burrows into the endometrium. So embryonic. We have the root of embryon, which means embryo. Ic means pertaining to. Fertilization. Fertiliz, which means fruitful. Ation is going to mean process. So the union of the male sperm with the female egg. Implantation. Im is my prefix. It means in. Plant means plant or insert. Then ation is process. So the attachment of the fertilized egg into the endometrium. Blastocyst. The root combining form, blasto, means germ or immature cell. Cyst means cyst or bladder. So the first 2 weeks of the developing embryo is also called a blastocyst. The placenta functions to transport nutrients and oxygen from the mother to the fetus. It transports nitrogenous wastes and carbon dioxide from the fetus to the mother. It transports maternal antibodies and hormones to the fetus, and it secretes hormones like estrogen and progesterone that helps to maintain that pregnancy. An amniocentesis and a chorionic villus sampling, CVS, are two common procedures used to check the health status of the fetus. In an amniocentesis, the amniotic fluid is removed, just a small portion of it. In a chorionic villus sampling, a sample of the chorionic villus cells is removed for biopsy. Both of these tests for chromosomal abnormalities and genetic birth defects. So during the embryonic development period, most of the embryo's external structures are visible and internal organs are formed. The placenta, the umbilical cord, the amnion, and the chorion are also formed. During the beginning of the fetal period at week 8 on, the heart is beating, bones begin to calcify, the external genitalia can be differentiated as male or female. The fetus continues to grow and develop. At 38 weeks, the fetus is considered full term and ready for birth. Ectopic pregnancy. An ectopic pregnancy occurs when there is an obstruction of in the uterine tube so that the embryo cannot move to the uterus for implantation. So instead, that embryo implants into that uterine tube. It can also implant into anywhere in the abdominal cavity. Preeclampsia is sudden abnormal increase in the maternal blood pressure after the 20th week of pregnancy, with edema to the face, the hands, the feet. It is also accompanied by proteinuria, so protein found in the urine. Eclampsia is life-threatening, characterized by signs and symptoms of preeclampsia with an addition of convulsions. Amniotic fluid abnormalities occur when the fetus breathes in and swallows amniotic fluid. In oligohydramnios, there is too little amniotic fluid. In polyhydramnios, there is too much amniotic fluid. This gestational diabetes occurs when a pregnant woman does not produce enough insulin, resulting in hyperglycemia. This increases the risk of preeclampsia and future type 2 diabetes for the mother. For the fetus, it increases the risk of perinatal mortality, birth trauma, and neonatal hypoglycemia. Hyperemus gravidarum is a condition in which morning sickness is persistent past that first trimester. So vomiting is extreme and it leads to dehydration. It actually happened to my mother, pregnant with me and my sister, ended up in the hospital on IVs and nutrient intake because she couldn't take it orally. Tetrogenesis is the production of fetal abnormalities, like congenital malformations caused by a chemical agent affecting the mother during early development of the fetus. The pterogens include alcohol, and retinol, isoretinol, the acne medicines, valproic acid, an anticonvulsant, and the rubella virus, amongst many more. So labor is divided into 3 stages, each of which is usually longer in a primipara than in a multipara. So primipara means their first pregnancy. Multipara means it's their second or more, second, third, fourth, however many. So in that first stage of labor is the dilation of the cervix. The cervix is typically dilated to about 10 centimeters to accommodate the size of the baby's head. The cervix is also thinner than effacement. The fetal membrane ruptures and that water breaks as amniotic fluid is released. That second stage of labor is the expulsion of the fetus. The baby's head generates additional pain as it stretches the cervix and the vagina. The head is visible, that crowning at the vulva, and the baby can be delivered. The umbilical cord is cut. That third stage of labor is that expulsion of the placenta, also known as the afterbirth. After the baby is delivered, the uterus continues to contract and push the placenta off the uterine wall to expel it from the vagina. Periperium is that 6 weeks postpartum after birth, the uterus shrinks back to its normal size. The vaginal discharge continues for about 10 days. So fetal distress. Fetal distress occurs when there is a lack of oxygen during labor. The baby is delivered as quickly as possible or via C-section if this occurs. Abnormal position of the fetus occurs at the beginning of labor when the baby is not in a head first or vertex position. Abnormal positions include breached, where you see the butt first, face, so you see that face instead of the top of the head, or shoulder. The shoulder and back are trying to exit first. We have a prolapsed umbilical cord. Occurs when the umbilical cord precedes the baby in the birthing canal. Pressure on the cord can cut off the baby's blood supply. Then we have the nuchal cord. Occurs when the cord is wrapped around the baby's neck during delivery. Premature rupture of the membranes increases the risk of her infection of the uterus and the fetus. So let's deconstruct some words. Effacement. Efface is that root, which means wipe out. Ment means resulting state. So effacement is the thinning of the cervix in relation to labor. Hyperemesis, hyper means excess. Emesis means vomiting. Hyperemesis means excessive vomiting. Primigravata, primi, means first. Gravata means pregnancy. Primigravata is the woman's first pregnancy. Periperium, per, is child. Then perium means bringing forth. Periperium is the 6-week period after birth in which the uterus invulates. Teratogenesis, terato, should say, means monster or malformed fetus. Then we have gen, first suffix, means create or produce. And esis means condition. So teratogenesis is the process of producing fetal deformities. Prematurity is when the baby is born too early. The lungs are underdeveloped, and premature babies result in respiratory distress syndrome. Also, the liver is immature and can impair the excretion of bilirubin, resulting in jaundice. Post-maturity occurs when the placenta begins to shrink, making it difficult to supply sufficient nutrients to the baby. And an abortion is an expulsion of the embryo or fetus from the uterus before 20 weeks of gestation. Medical terms only. So there's different placental disorders. Preventa abruptio is the separation of the placenta from the uterine wall before the delivery of the baby. The baby's oxygen supply is cut off and the fetal distress will start to occur. Placenta previa is a low-lying placenta between the baby's head and the internal os of the cervix. So that placenta is blocking the exit canal pretty much. This can cause severe bleeding during labor. And then a retained placenta, all or part of that placenta and or that membrane remains behind in the uterus 30 minutes to an hour after the baby is delivered. This usually results in postpartum hemorrhaging. So a cesarean section, Roman law under Caesars required pregnant women who died to be cut open and the fetus to be extracted. The extraction of the fetus through the incision in the abdomen and uterine wall. So that's how this started. Meconium is Greek meaning little puppy or poppy. It is the first bowel movement of a newborn. Nuchal cord is the French meaning back, nape of the neck. So when the umbilical cord wraps around the fetal neck. Placenta abruptio. Abruptio is Latin meaning break off, the premature detachment of the placenta. Vertex is the Latin word for whorl, so the topmost point of the vault of the skull. Let's go through some diagnostic procedures and pharmacology here. Obstetrical diagnostic procedures. Chorionic villus sampling uses ultrasound guidance to insert a needle through the abdomen or a catheter through the cervix to obtain a sample of placental tissues. Cystic fibrosis screening is a blood test to determine the presence of the gene that causes cystic fibrosis. Ultrasound can be used to show most of the organs and bones of the baby in utero. And then that amniocentesis uses ultrasound guidance to insert a thin needle through the abdominal wall into the amniotic sac around the baby to remove a small amount of amniotic fluid. The female breast. So the mammary glands develop during pregnancy to produce milk, that lactation. Colostrum is the first secretion from the breast during pregnancy. It contains more protein and less fat than human milk. It also contains immunoglobulins, those that give the baby protection from infection. Mastitis is an inflammation of the breast. It can occur in association with breastfeeding if the nipple or areola, the area around it, is cracked or traumatized. Mastalgia. Breast pain is the most common benign breast disorder. The pain may be associated with breast tenderness or PMS. Paget's disease of the nipple presents as scaling, crusting lesion of the nipple, sometimes with a discharge from the nipple. It is indicative of an underlying cancer. Nipple discharge, particularly if it is bloody and only from one breast, it is indicative of an underlying disorder like breast cancer. Fibroadenomas are confined small benign tumors that can be either cystic or solid and can be multiple. Fibrocystic breast disease presents as a dense, irregular cobblestone consistency of the breast, often with intermittent breast discomfort. Breast cancer risk factors include family history, particularly of a woman, if a woman carries either the BRCA1 or BRCA2 gene. The use of postmenopausal estrogen therapy and in early menarche and late menopause are all risk factors. Galactorrhea occurs when a woman produces milk when she is not breastfeeding. And gynecomastia is an enlargement of a breast that can be unilateral or bilateral, and it can even happen in males, gynecomastia. So let's deconstruct some words. Fibroadenoma. Fibro, that combining form, meaning fiber. Aden, aden means gland, and that suffix oma means tumor. Galactorrhea, galacto, means milk, and that suffix rhea means flow. Gynecomastia, that root gyneco, or combined form, means female. Mast means breast, and that I at the end means condition. Mastalgia, again, mast means breast, and that algia means pain. Mastectomy, mast means breast, that ectomy means that surgical excision. So the female reproductive system is technically dormant until puberty, when the ovaries begin to secrete significant amounts of sex hormones, that estrogen and progesterone. During puberty, the external genitalia become more prominent, and those secondary sex characteristics start to develop. This is when menstrual cycles will start to occur. Thank you very much for listening. If you have any questions, feel free to reach out. Otherwise, have a wonderful day. Thank you. Bye.